Minister of St. Martin, the Honorable Silvera Jacobs, Secretary General of the Ministry of Tourism, Economic Affairs, Transport, and Telecommunication, Miguel DeWeaver, Fire Chief and National Disaster Coordinator, Clive Richardson, Chief of Police, Carl John, Head of Collective Prevention Services, Ava Lisa DeWeaver. Good morning, and on behalf of the Prime Minister, as Chairperson of the Emergency Operations Center, the EOC, I welcome you to this press briefing regarding an update on the national response to the coronavirus disease, COVID-19. For more on this topic, I invite the Honorable Prime Minister of St. Martin, Silvera Jacobs, to provide you with more remarks.
The introduction. Welcome to the panel of the EOC. It is my pleasure to stand here or sit here this morning as EOC, the leader of the EOC, together with the chairperson and the key persons related to the coronavirus as we are dealing with it on a day-to-day basis. Yesterday, an update meeting was held specifically in dealing with travel restrictions and the possibility that this might be necessary for St. Martin. We have been in discussion with several stakeholders, including our French counterparts, and because of our connection to the kingdom, it is important that we highlight to them and to especially Foreign Affairs that this is a serious threat for St. Martin. We would like to reiterate that there are currently 0 cases, whether they've been highlighted as possible or confirmed cases on Dutch St. Martin, and that the 2 cases that have been confirmed on the French side are in good condition, exhibiting no symptoms. Because of St. Martin's open borders and the threat of daily travel, we have been asking the ports to update their screening processes and to ensure that persons traveling to St. Martin are also screened. The first critical measure that we've taken is to take the decision to institute, at least for now, a temporary travel restriction to the island from the countries where the clusters have been identified. These are mainly places like in China, Chinese Taipei, Hong Kong, Iran, Italy, certain cities in France, such as Loise, where the current victims are hailed from, Japan, South Korea, Malaysia, Nepal, as well as some other Asian countries. Passengers who have been within these areas in the past 2 weeks will be restricted from coming to St. Martin. If they are showing symptoms, then of course they will go through even further screening. The finalization of getting this procedure in place is still ongoing, so the information still has to be shared, discussed, and move forward. This is the intention of St. Martin. We feel that this is necessary because of St. Martin's size. St. Martin's capacity is quite small. This is a reality we face, even if we have a local situation pre-coronavirus time. We only have a limited amount of beds in hospital for emergencies, and therefore persons are shipped out of St. Martin once they are stable enough to do so. So taking that into consideration, we seriously even looking at what could be considered discrimination if we incorporated strict screening methods for St. Martin's capacity. The reality of it is that we have minimal spaces. We also are, as a small country, have a small hospital. The lab, as you learned earlier in the press briefing, does not carry out the testing for the virus, and there's also limited space for quarantining. Whilst we are in discussion with IHR, which is the International Health Regulation Network in the Netherlands, which regulates for the entire kingdom, and we are cooperating with those regulations. We are in collaboration and contact with PAHO. Today, our health and our health department and CPS will be in a WebEx with PAHO to finalize the discussions on what equipment and technical support in the form of training and reinforcement so that our CPS can carry out should an outbreak take place. That will take place this afternoon. We have already contacted our colleagues at UNDAC for technical assistance, which has been confirmed. We also have confirmation from PAHOS, as mentioned, and within the kingdom itself, the discussions are ongoing into how the assistance would be regulated should an outbreak take place. For us, in advance of an outbreak, we see the need for more training to take place because CPS is already being burdened with training. As I mentioned this morning, training is taking place with frontliners. So the airport received an overview last evening. Others are being encouraged to contact CPS, but we have seen where, for instance, within the hotel industry, that several have already instituted their own procedures and have trained their personnel. Of course, with inspections, we are going through and will ensure that all hotels are maintaining the same high levels. So CPS is being heavily burdened, and so we see as a current need is for more technical support where training is concerned, and if we would then have to make home visits if self-isolation is recommended or required. Of course, we can get from the from the professionals on the panel, direct responses if there are further questions in this regard. I know also because of our upcoming festival, the regatta, which has been planned for some time, and of course, the question was asked this morning about government support of this event, which is a yearly event. I must say that the protocols that the regatta has provided to government of St. Martin, this was requested, they were already in place. The regatta had already made great contact with CPS, with the Ministry of TIAT, and with the Ministry of Justice to ensure that the participants in the regatta are properly screened and will continue to be screened as they enter the harbor or the lagoon. Those entering via the airport will also be checked, and CPS is going to be conducting a training for all regatta volunteers and workers this evening to ensure that they are maintaining the high standards. The regatta itself has been providing information to all their stakeholders aimed at educating and reassuring the protocols at the ports. They have also recommended to their participants to be isolated in case they are showing symptoms. They have an awareness before the event. There will be PSAs via the radio. There will also be on the digital boards information displayed, and during the event as well, the World Health Organization video will be played and signage will be placed around the venue to ensure that persons are educated. Also, hand sanitizing stations, which do not require you to touch them but just to get it automatically, have been placed around the site for participants and visitors, and literature has been distributed at the airport and throughout the village. Food safety and hygiene protocols are being checked and double-checked by CPS. The inspectors, health inspectors have been there and will continue to be there prior to and during the event. So a meeting yesterday was held to ensure that all of this was received. The tourist office is also heavily involved, as is the harbor. The harbor also reiterated that they will be distributing, as also sponsors of this event, they will be distributing hand sanitizers during the event as well. So that is in terms of our preparation for the regatta, the Heineken regatta. All these steps and procedures that have been taken are being taken with the health and safety and the protection of St. Martin citizens as a priority. I would like the people of St. Martin to understand that I've heard that they're not sure what we mean when we say by protocols. The airport and the harbor have clear-cut protocols, which are procedures in place for dealing with a suspicion case or a reported case. These protocols and procedures will be published on government website during the course of today if they are not already there or on the websites of the harbor and the airport. We've also received from the police department and the public health and CPS departments. We think it is important that the public can know where to go to get this information and to make it readily available. Of course, the protocols are pages and pages long, so I've asked them to synopsize it so that it is at least just an A4 or minimally 2 pages so that the public can get it in bite-sized chunks. Also, where the Department of Communications is concerned, we are also upping the communication to the general public. We are currently in the preparation phase of bulletins that will be going out via the public, the digital boards around the island. The public is also encouraged to visit DCOM, the Facebook page of the government of St. Martin. There are special bulletins specific to coronavirus that you will immediately find, and all literature that will be posted will have these sites so that the general public can go. We have established also a quick number, a hotline, if you would like to call it that, but it is mainly for information. All persons on St. Martin, whether they are visitors or residents, if you feel that you have been exposed to the coronavirus or an infectious virus disease, you should contact your GP and stay at home. If your symptoms become grave, your GP should be able to tell you whether it is time now to be admitted to hospital. CPS will be notified via your GP, your general practitioner, your doctor. Of course, the number 914, which goes directly to CPS, can be used during working hours if you have questions pertaining to this, if you cannot get enough information via the Facebook pages, as I've mentioned before. So you can call this number during the number 914 for a direct contact to CPS for questions related to this. However, if you are in an emergency, of course, the ambulance department is the department you should call, and then CPS will be notified via the ambulance or the emergency room if that is the case. We do not want that people feel that there is a general panic. I know that some are saying they cannot find hand sanitizers in the stores. We have looked into getting the vendors. Most of the vendors who have notified us too that they are running low have stated that they are expecting shipments this week. As I open the papers, I'm seeing that even in the Netherlands, certain places have put up signs that they have run out of certain supplies. As this is a worldwide problem, we will see more and more that supplies will run low. We have also made an emergency request for some of these types of supplies, including gloves and other protective gear for especially our first responders and frontliners who will be dealing with these cases when and if one is identified on the Dutch side of St. Martin. Collaboration with our kingdom partners within the Caribbean is our first line of collaboration, but we also have, of course, strong collaboration with our kingdom partners in the Netherlands, as well as international partners who are standing ready to assist us should any outbreaks take place. For us at this moment, it is what worldwide everyone is trying to do, is to identify, to mitigate, to isolate, and to educate. So for us, the information that has gone out to the schools, we would like to ensure that those are being the information is being disseminated to the schools, that it is child-friendly, that we are not creating more panic by offering information, but that through education and through knowledge, we will know how to better protect ourselves. Education and frontliners, those are the two main areas where, as a country, we are working at mitigating and eliminating possibility for the spread of the disease. So I hope by this information I have been able to reassure. If there are questions that the media has besides what has been asked, any member on the panel, I will then point out to any member of the panel who would be best able to answer if I cannot.
Thank you, Prime Minister Silveria Jacobs. The floor is now open. Stephen Cyrillian of PJ82 Radio, you have the floor.
Excellencies, good morning. My question is for the Minister of General Affairs. We know that Foreign Affairs is responsible or is the responsibility of the Kingdom Council of Ministers. You spoke of the restrictions that have been placed on persons coming from China, Italy, France, and so on. What collaboration, if any, was there between St. Martin and the Kingdom Council of Ministers?
Okay, at this stage, thank you, Stephen, for that question. It is not a collaboration with the entire Kingdom Council of Ministers, but the Ministry of Foreign Affairs. Through the Ministry of Foreign Affairs, our Department of Foreign Affairs has a direct link, and so the discussions, information is shared via that, but also through our Kingdom and Interior Relations Department, BUC. So we deal directly with our Kingdom partners through BUC and through our Foreign Affairs through that one ministry with our Department of FBB. Through that, we get daily updates pertaining to which countries are now, we get the updates on what's going on in the rest of the kingdom as well, but also where clusters of outbreaks have been identified. So we get that information from the WHO, and we get it from the IHR, which is in the Kingdom of the Netherlands, or in the Netherlands, representing the kingdom. So those collaborations are daily, and we're updated. They have been updated that we are intending to institute the travel restrictions. Of course, they will have feedback, etc., because it would have to go through them. So our request will go through the Ministry of Buitenlandse Zaken, so Foreign Affairs of the Netherlands, and that will then be sent out to, what was the name of that? The people. To the thematic, which will then send it out to an IATA to send it out around the world. So the information that we would like has been already sent last night to the Ministry of Foreign Affairs, and we are awaiting response in terms of how it will be done, whether we will be blocked from doing so, etc.
Thank you, Prime Minister. Lyndon Brown of BCN TV, you have the floor.
Question to Mr. John. Apart from the regular immigration check at the different points, the airport, the harbor, is there any camera setup like that will determine that there's something wrong with any person that come into the island? Why I asked that, for instance, I was speaking to a gentleman that went to Cuba, and there was camera that make alarm if there is any symptoms of any person passing through.
Thank you, Mr. Brown, for the question. I must say our participation in the whole working situation about Corona is mainly about detection and managing the situation a little bit when it comes to public safety. When it comes to detection, we go as far as the immigration officers asking a few questions to the guests, and also try to disseminate information on who to contact in case of symptoms. There is no camera system as such set up to detect symptoms.
Thank you, Police Chief John. Prime Minister.
Yes, I would like to add to Chief John's answer in the sense of the questions are being asked at, what we were relying on is that the questions would have been asked at the ports of entry prior to coming to St. Martin. Of course, if persons display symptoms, persons are in the arrival hall that will be able to identify and pull such persons aside and ask the questions so that they're not for a long time in the line. Once they get to the immigration will ask the questions as well to determine the travel history of the person and to issue some some recommendations for if symptoms either develop, get worse, or the like. If persons come with symptoms and they have been in these areas, they will be automatically recommended for quarantine.
Thank you, Prime Minister. Dimitri Wheatfield of the Daily Herald, you have the floor.
So, good morning to the panel of the EOC. My question is to the Prime Minister. You stated several countries that will be subject to the travel restrictions if approved. Many of them are logical because they are hotbeds of where the virus is currently. But one that surprised me was Nepal, considering that the WHO situation report dated yesterday said that Nepal had one total confirmed case and it didn't have a case for the last 39 days. Can you explain why Nepal was added to the list?
Okay, we just had a blanket group of countries that had been recognized prior. So if any country is not recognized by the WHO, we are willing to remove that. As I said, we are still in discussion with Foreign Affairs as to what the final list will be. The most, the one that would be the trickiest or the one that would probably cause the most discussion would be the ones originating in France, as they are part, we have daily flights. We see it as a threat to us, mainly because the two passengers were identified as going through that area, which is the cluster in France. Of course, the French would like to see free movement of their citizens, but we cannot run the risk that any more persons who could be infected that come through those areas are here. So we would have stricter controls even in advance of that in terms of the questions and asking. So people will run the risk of being quarantined if they still insist in advance of the restrictions being placed. They run the risk of being quarantined because we have a hub function here on St. Martin. A lot of people travel to St. Martin to get to other countries. And if other countries, we are also looking at our the feeder countries that take passengers from us. If they do not take them, then these persons will be stuck in St. Martin. And our capacity is small. So we are also taking our cues from our surrounding islands. And if they have certain restrictions, we also have to maintain that. At the moment, anyone traveling to Anguilla, if they have traveled to any of these areas, they run the risk of being quarantined. So if we are not allowed via our kingdom relations and our foreign affairs to restrict passengers completely from these areas who have traveled to these areas within the past 2 weeks, then we will then have to put in that they run the risk of being quarantined. Because once we do our questioning here, once they enter our port, and we find that they have been in these areas and they do not have a medical declaration that states that they have not had symptoms related or similar to COVID in the past 2 weeks, then we have no other choice but to keep them isolated for the time to ensure that they do not develop those symptoms.
Thank you, Prime Minister. We now move on to the next round of questions. Stephen Cerulean, you have the floor.
Questions for the Prime Minister. CARICOM heads of government met over the weekend in an emergency session to discuss the ongoing coronavirus issue. We know that St. Martin is yet to receive its associate status with CARICOM. Nonetheless, you have the observation status. Have you been brought up to speed as to the discussion? Because a number of entities were also part of this CARICOM meeting, which St. Martin is part of, CAFA and PAHO as well.
Yes, thank you, Stephen. As mentioned before, St. Martin Foreign Affairs Office is monitoring all these entities. We do have relationships also with SEDEMA, which we recently petitioned to become members of, and we hosted their conference here in December. We are in direct all of the protocols are basically in line with PAHO's and the WHO's, which we are already following, as well as the IHR, which is within our kingdom. I have a report in front of me dated the 4th of March, that comes with what CARICOM recommends, and so their recommendations are also being taken along. Of course, being within the Caribbean context, and we will continue to collaborate as much as possible within our legal constraints. But of course, our first line of assistance would come from within the kingdom or the international agencies. The Department of Foreign Affairs, DBB, has asked for a direct copy from CARICOM of the mentioned protocols and is also in close contact with our embassies in the Dominican Republic and Trinidad as relates to staying up to date on the information.
Thank you, Prime Minister. Lyndon Brown, you have the floor.
Christian, I believe all of the panelists can answer this question. There's a lot of people fearful that if there's an outbreak, is the government of St. Martin has a budget, are preparing a budget, like for food, water. The reason for this question, I was listening to the United States media, and they're saying that people around the world should prepare for this virus as hurricane. We have the fire chief here, and so I believe you all can zoom in, comment on this matter. How St. Martin government stand? Is there budget pending? Food, water, shelter? What's gonna happen if there's an outbreak?
I'll take the lead on this, and then I'll allow the other panelists to say something. Budget of St. Martin, the panelists wouldn't really have much control over that. However, we do, from disaster management point of view, have a budget for disaster management. We will have to be, of course, careful with it, and that's why we've made the requests from the international agencies. Once the EOC has been enacted, we have a greater chance to be able to receive such from the international agencies without having to pay. Of course, there are certain things we would still have to pay for. We are asking the local vendors to ensure that they have certain hygiene materials on hand for government, to reserve for government, so that we are able to take care of the needs of especially our first responders and frontliners. So that has already been done. Of course, price gouging, we are also mitigating via the Department of Economic Licenses and the inspection to ensure that people don't suddenly raise prices on these necessary items. But what you said, Mr. Brown, is key. We are an island that is constantly prepared for hurricanes. That is one of the things we know how to prepare for. So in that realm, of course, we are asking the population to, just like if you have to be contained within your home for 14 days, then it would make sense that you have enough food and water and medication in your home to be able to sustain yourself and minimize contact with the outside world. But to continue or give any further update, I would pass the word to the chair of the EOC, Mr. Clive Richardson.
Good morning, and thank you, Prime Minister. One point of clarity. I am the National Disaster Coordinator. The Prime Minister is the chair of the EOC. We do have a budget which has been prepared, which is prepared every year in case of a situation that the Prime Minister can directly use the budget to assist in whichever need she see necessary. It's not the biggest budget, but it can assist if necessary. I'll pass the back.
Thank you, Fire Chief Richardson. Thank you, Prime Minister. If there are no other panelists, we move on to the final question. Dimitri Whitfield, you have the floor.
My final question is to the Prime Minister. Is a follow-up question to the question I asked earlier during the press briefing. This is just a follow-up question to the question I asked earlier in the press briefing about testing. You indicated that in case of suspected cases and we have to do testing, they would go to the Netherlands laboratories for confirmation. How long approximately would that take? And recently it was reported that Caribbean countries, particularly Barbados, has the capability of testing for COVID-19. are you looking at the possibility of sending these tests regionally to be confirmed, and also Guadeloupe?
Thank you, Dimitri. Yes, so currently our protocols is within the kingdom, and so they go to the Netherlands. As we mentioned, we were looking at Curacao, which was getting the capabilities as well. As soon as they have it, it is closer. Right now, it takes 3 to 4 days to get a response. It would take 3 to 4 days. We have not sent any yet, but of course, the kingdom criteria to be able to test would be the person would already have to have shown symptoms and have been exposed to someone who has been in one of the cluster areas. So not just any and anybody with symptoms would be able to test it that way. The first way to eliminate a person would be then to self-isolate if they have no symptoms. So only persons with symptoms would be able to be tested if they have been in the vicinity of someone that has been in one of the cluster areas. That other Caribbean countries have received that would of course come through Foreign Affairs. If that possibility exists, we will explore that with the CARICOM, as Barbados is one of the CARICOM countries. If they would allow that, we would have to of course arrange how they would be paid, etc., and that would then be a secondary option if possible. But for now, we are remaining within the confines of our kingdom and the possibilities therein. Afa?
Yep, just to elaborate on what the Prime Minister said, before samples are drawn, there has to be adherence to a case definition. So do you meet certain signs and symptoms? Do you meet the travel history? And then from that, whatever information is gathered, then we have to determine whether or not it fits the case definitions to be tested at the laboratory. The laboratory locally would then have to send those samples, as Prime Minister mentioned, to the Netherlands. So I don't want to speak on the behalf of SLS, who is our national laboratory, but there needs to be, MOUs or agreements in place to see if we have the capacity to send the samples elsewhere. But right now, our directive comes from the Netherlands, from the REVM, which is the public health entity, the laboratory entity in the Netherlands. So unless they've changed the criteria for sample collection, we have to adhere currently to what is established and what's according to their guidelines to send the samples.
Thank you, Mrs. Ava Lista de Weaver. Seeing that now the questions have concluded, I will allow each panelist to provide some closing remarks before we end the broadcast, starting with Chief of the Police, Mr. Carl John.
Thank you. I must say, as coordinator of ESF 5, all law enforcement agencies are well informed and well equipped to deal with the situation. The information that we disseminate starts with all workers having information on how to protect themselves, and after that, really the focus on trying to help detect anyone who pass for sure the border points with any symptoms. And in collaboration with other stakeholders, then we follow protocols, as was mentioned by the Prime Minister, and which will lead to isolation if necessary. Thank you.
Thank you, Police Chief John. We now move on to the Secretary General of TIAT, Mr. Miguel de Weaver.
Thank you, Ms. Roach. Good day to the general public. I think I would like to emphasize today that the approach of the government when it comes to this problem is, first is we recognize that this is a worldwide problem. As you know, the famous saying now is, it's not a matter of if, but when it will come. And all we can do in the interim is to prepare. And what do we do what do we do as it relates, and what are we doing as it relates to our country and our ports of entry, because that's mainly the way in which it comes in, is to make sure and try to have these restrictions in place so that we can minimize the risk of persons coming into the island, and by them being asked questions from wherever they're coming from the initial trying to get to on an airplane, that those questions and that screening is done in those countries. And that minimizes the problem coming to our country. And then when we reach here, then our internal procedures at the airports and harbor are being done. Naturally, at the harbor, there are also some screening that they do as well at the airports as well. And once they're here, of course, whether in the hotels or whether at events, we're also wanting to make sure that those hotels and at those events, that the proper information is prepared or presented to those folks, to the visitors, so that we execute proper hygiene. And I think from our end as well, one of the things we are appealing to businesses is to please don't try to take advantage of the situation. But we must also recognize as well that critical items are becoming scarce worldwide. That has consequences everywhere. Us being a dot on the world map compared to the volume of other places that is demanding products, automatically we know prices are going to increase, but we don't want that businesses are taking advantage of the situation whereby it becomes even more and exceptionally and unacceptably high. So we want to appeal to the conscience of the business community. We are going to be putting these type of products on the disaster maximum price list, such as the masks, such as the Lysol, such as the gloves, so that we can make sure that minimum price gouging takes place. We also want to, how should I say, appeal to the public to remain calm and just prepare. As we prepare for hurricane, I think the health folks will probably give, and I think the Prime Minister has been emphasizing and re-emphasizing the nature of this disease. The isolation is pretty much so that you can stop the spreading. It's not that it's a death sentence, of course, excluding the high-risk persons, elderly, young, and pre-existing conditions. But we remain calm and we prepare. We make plans. We have a discussion with our family. If something happens, how do we where do we go? What do we need to have to make sure that we buy them piece by piece as we go, so that we can prepare to be, if in the event, God forbid, that we have to be isolated. So I think I appeal again that we remain calm. We do the necessary preparations. We don't take advantage of the situation, and that we protect ourselves from as what has been presented and the continuous information that we get.
Thank you, SG DeWeaver. Fire Chief and National Disaster Coordinator, Clive Richardson.
Well, as Fire Chief, I really don't have a big role in this situation. As National Disaster Coordinator, I am there to help the Prime Minister and inform her about decisions that are taken, carried out, evaluate, and if we have to tweak to make sure that it's we have to adjust to make sure we get the results that we require. I am there to make sure that that is coordinated between the different ESF coordinators within the EOC. So that is mostly my role at the moment. So at the moment, I am not one of the big players. So.
Thank you, Fire Chief Richardson. And Head of Collective Prevention Services, Ms. Ava Lisa DeWeaver.
So I think just some final points. So as an executing agency of the Ministry of Health, our bread and butter is monitoring infectious diseases on a daily basis. We follow up with persons who are infected with infectious diseases. We educate them. We promote health and safety. We are sort of the lifeline for understanding infectious diseases in St. Martin. COVID-19 is no different. Yes, there is, it is a global issue, and the key is preparedness. And through, I guess, over the last 3 months, the team at CPS has actually been very proactive, not only updating our protocols and our processes, but making sure that we educate and make everyone aware on what to do. So stressing the prevention measures. Again, it is flu season, so making sure that everyone, understands the importance of proper hand hygiene, proper sneezing, proper coughing, just making sure that we target different audiences all the time. Our office is always available. Anyone can walk in, anyone can contact us. And again, as the Prime Minister mentioned, we have activated a helpline or a question line, 914. But I would like to stress that, prevention goes a long way. And again, not to alarm, not to panic, making sure that you're well informed, debunk and don't listen to a lot of the information that's being put out there. Instead, educate yourself. If you have questions, my department is always available. We have a great surveillance team, and I encourage anyone to visit the St. Martin government website as well. There's also a coronavirus link that provides updates on the situation globally, locally, and what steps we're doing as government to make sure that we keep our visitors and our population safe. Thank you.
Thank you, Ms. Ava Lister Weaver. Prime Minister Sylvia Jacobs.
Thank you once again, Relaika, and to the panelists here with me today from the various ESFs related to this threat. I must say that I am quite proud of the St. Martin professionals that I've had to deal with over the past few days. It is my first time, and it's a growing and learning experience for all of us. I'm taking their advice quite strongly. We are meeting on a daily basis, so I want to thank them for the sacrifices that they're making, because their regular work also still has to continue, as does mine. So I would like to say thank you to them. Reiterate again that our two-prong approach is right now in terms of prevention and mitigation. If it is detected, the education and awareness is the first thing that our Kingdom partners are also promoting, as well as education and protection and awareness of our frontliners. We've been using some terms that I want to clarify. Protocols are basically the procedures that each entity is engaged in. So what will be done for case A, for case B, for case C. These things have been properly planned in advance, and each entity knows what they are supposed to do. However, we have recognized that education towards the public as to what these procedures are has been lagging, and so as a result, we are getting shorter versions to be put on our government information page, on my Prime Minister page, as well as CPS's, to ensure that the public has direct link to that information of what is being done by each entity in the event of, or even prior to and in this phase of preparation. The schools have been all contacted via the Ministry of Education. A letter was sent out. CPS has also assured me that they have, more than a month ago, been in contact with all the schools. As you know, we were in the midst of flu season, and many children as well as staff and teachers were presenting as ill. So the schools have their safety plans in place. The Safety and Emergency Management Committee of the schools, which was established in June of 2018, has been doing its due diligence as well. They've established a comprehensive school safety framework and set up plans and strategies for safety and emergency management within the ministry's sectors, not just education. So they have sent out key messages from CPS to all school boards since January 31st, key information regarding communication with teachers, parents, and students about COVID-19, also about suggestions about disinfecting the premises has gone out. They've been working with CPS to align protocols, procedures for schools as it pertains to infectious diseases in general, and a meeting is scheduled with representatives of the school boards, school managers, directors, and a chairperson of the said team on this Friday. So Ms. Lista De Weaver has been quite busy, as that's why I mentioned that we do need some support so we don't run her into the ground. Very important, just taking the position as a young St. Martiner and in a precarious condition herself. So I must say we have taken many, many precautions. We are coordinating, and I would like to thank the population for continuing to listen to the government organizations' communication methods, because many others, while I understand they're trying to share information, have not confirmed that they are facts. The police, the health, communication, and government affairs, as well as telecommunications TIAT are working together as the team that is directly influenced by the coronavirus, and we will keep you updated on a daily basis and on a weekly basis as necessary.
Thank you, Prime Minister. Prime Minister, EOC members, members of the media, radio listeners, and online viewers, this brings us to the end of this broadcast. For rebroadcast, tune in on St. Martin Cable TV and via St. Martin Gov Radio 107.9 FM. Be sure to visit stmartingov.org for further updates about the corona disease COVID-19 as they are made available. On behalf of the Department of Communication and the Government of St. Martin, I'm Relaika Roach and bidding you a pleasant day further.